Hello, my name is Rachel Geraghty, and today I'll be discussing the topic of out-of-hospital cardiac arrest and nursing management. Firstly, cardiac arrest that occurs outside of the hospital is a major cause of unexpected death in developed nations such as Australia, with mortality rates between 65 and 95%. However, those who are initially resuscitated and have spontaneous return of circulation will be further challenged by anoxic neurologic injury. This largely accounts for the majority of rates in morbidity and mortality post-resuscitation. An issue that is evident within my workplace is a lack of multidisciplinary approach towards end-of-life care and a lack of support for cultural differences in patients who have suffered an out-of-hospital cardiac arrest. Therefore, my first research question is, does the implementation of having specialist teams such as pastoral and palliative care services in those who have suffered an out-of-hospital cardiac arrest promote better outcomes for the patient's family as compared to having no specialist team involvement with medical care directed by intensive care physicians and nursing staff only? Secondly, can the implementation of education programs surrounding the importance of cultural sensitivity and beliefs enable better patient-centered care for patients who have sustained an out-of-hospital cardiac arrest as compared to having end-of-life care delivered as a standard approach? This mind map commences with out-of-hospital cardiac arrest as the main focus. From here, the first row branching out demonstrates the transition from pre-arrest to the ambulance call-out, following onto the path of the ambulance arrival and interventions, so that hopefully a ROSC can be achieved so that a hospital transfer can occur. After the appropriate transfers within the hospital, the patient then arrives into ICU for the post-arrest management. It is evident that post-arrest management incorporates many levels of evidence-based practices which are carried out in a timely manner and usually executed very well. However, upon reflection, it was evident that there was inadequate family care and support at times. From this finding, I was able to question if having these support measures and interventions, such as pastoral care teams and palliative specialist teams in place, would assist in the patient-centered care and more evidently support for the family. Additionally, another concept within this area was that of culture. It was also evident that within my workplace, a lack of cultural sensitivity and cultural support is given to these patients during the end-of-life care. In order to carry out a systematic and comprehensive search on peer-reviewed articles, additional techniques will be utilised. This includes the Advanced Search Health through Deakin Library, allowing for platforms such as EBSCOhost to be used, which further includes databases such as Medline Complete, Sonal Complete, PsycInfo, Global Health, and ERIC. An inclusion criteria will demonstrate the use of peer-reviewed articles only, articles written in English, and publication year after 2000 to ensure contemporary literature. Here listed are keywords that will be used alongside additional search techniques. An exploratory descriptive method could be used as potential research design to investigate question 1. This qualitative method is conducted in natural settings such as a clinical environment in order to provide at least control of the variables. The data is then collected and either contributes to the development of theory or to explain the phenomena from the perspective of the persons being studied. Methods such as surveys, polls, and interviews are primary research approaches that can be used to gain qualitative data. This research design has advantages and limitations as discussed. A randomized control trial could be used as potential research design to investigate question 2. A randomized control trial is an appropriate method for this topic of research as it looks into the effectiveness of an intervention. This is usually conducted by comparing data between a treatment group and a control group. This research methodology also has advantages and limitations, as briefly mentioned.